So you're having shoulder pain, shoulder restriction and movement. There's a lot of clicking that you hear in your shoulder as you move your arms, and you're wondering what the heck is going on and what to do about it. Hey, I'm Dr. Shaki from Irvine Spine and Wellness Center, your Irvine Chiropractic and Posture Clinic, and this video is just for you. All right, so I've already said why you would be doing this exercise, so we're just going to jump right in and do it. What I want you to do is lift your arm up on both sides, but we're going to use it on this side only at this juncture, and make sure that your trap, the top of your shoulder does not lift up. So this is nice and dropped, and you're simply bringing your arm up. As you're bringing your arm up to this level, your shoulder blades should not come up. So the bottom portion of your shoulder blades, those muscles, are going to grab your shoulder blade and pull it down as you're lifting your arm up to be parallel to the ground. You're not having loosey-goosey wrists. Everything is nicely extended and not pulled away from your body like someone's pulling you that way, but just in a nice, firm way. So you're doing it on both sides, and then you go with facing the front, with the palm facing the front, and bringing your hand up to a 90-degree angle without dropping the elbow or lifting the shoulder, the top of the shoulder. So that's all there. The other thing that I want to make sure doesn't happen is you going that way and letting your scapula rolling forward. So how do you know if your scapula is rolled forward? If your elbow is in front of your shoulder. So if that's gone forward, you're going to bring it back and lock the scapula in place. Let me tell you, locking your scapula in place does not mean you stick your chest out, just so you know. So you go through that on both sides. I've noticed in doing this exercise, my right side has a little bit of a challenge because my wrist keeps going back. That's because of the restriction in my shoulder joint. So I'm gonna try to do it correctly. This way, glide your neck back. You're not sticking your butt out or tucking under your pelvis. You're staying with a neutral spine. You bring your arm up, dropping the shoulder, scapula is keeping everything in place, neck is going back, and now I go through the movement. In this movement, I'm not lifting my shoulder up, my elbow and my shoulders are in the same line, and everything, it's a great workout. I definitely feel these muscles just holding them up. The right muscles are engaging and the right muscles are holding. So I go through that, and now I'm gonna rotate around my elbow without lifting to the top of my shoulder. So keeping that is definitely a workout. And then you come back up and you keep it there, and you go back without sticking your chest out. There's not much range of motion in that area in this position. So you go through that, come back up, this, and down. I definitely can feel conditioning these muscles here, and I do this several times a day with my patients, pretty much, at least once. No, definitely more than that. But the whole point here is, if you do it every day, just a couple minutes, it really is a great workout. But there's a key to that, and that is doing it correctly, gliding the neck back, engaging your pelvic diaphragm. Let's make sure that we put the video on that at the end of this video, and that's about it. If you have not subscribed to my YouTube channel, this is your chance to do so. Until next time, take care.